Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today I'm talking about serotonin syndrome, and this is based on a few viewer questions about this. Sage asks, can you do a video about serotonin syndrome, drugs that cause it, what it looks like, and how fatal is it? Thank you, Sage, for that question. Serotonin is a brain chemical, also called a neurotransmitter, that plays a role in controlling your mood and anxiety. Low levels of this in your brain contribute to depression and anxiety. Therefore, many of the medications that we use to treat depression and anxiety work by increasing the levels of serotonin in your brain. Normally, there's no problem with increasing serotonin in this way. After all, the reason for the increase is because of the low levels that you already have if you're depressed or anxious. Even if you weren't really depressed or anxious and you took these medications, that small increase wouldn't cause serotonin syndrome. Serotonin syndrome happens when you get an excess amount of serotonin from taking super high doses of the medication, like if you were taking an overdose, or when medications get combined with other medications that also increase serotonin. There are medications that are not antidepressants that increase serotonin, and some of these are pain medications like tramadol, nausea medications like Reglan, and some migraine medications like Imitrex. Some other examples that you probably didn't realize increase serotonin are dextromethorphan, that's found in cough and cold remedies, like Robitussin, and some antibiotics like ciprofloxacin or fluconazole, which is an antifungal drug. So if you take multiple medications, someone needs to check the interactions between the medications to make sure that you don't have this problem. Normally, your doctor would do this, and sometimes your pharmacy will give you a warning. This is why it's important to tell all of your doctors all the medications that you're taking, including things that you take over the counter. But to make sure things don't slip through the cracks, you can check yourself. And this is especially important if you have a cold and you take something over the counter. You can check using WebMD's Drug Interaction Checker. It's under Drugs and Supplements and then Tools. It's important to know, though, that just because it shows that you're taking two medications that can increase serotonin doesn't mean that you will get serotonin syndrome. It just means that you need to be on alert for symptoms and pay close attention if any other medications are added to your regimen. So what does serotonin syndrome look like? Your symptoms can be mild to severe and fall under three groupings. We call this the triad of symptoms of serotonin syndrome. These are changes in your mental state, abnormal muscular tone, and hyperactive autonomic nervous system. Let's take a look at these one at a time. Changes in mental state, also called mental status changes, include things like agitation, extreme anxiety, being disoriented or confused, restlessness, and pacing. Abnormal muscular tone would be things like tremors, clonus, which is an involuntary contraction and relaxation of your muscle. We mostly see this in the ankle, but you can also see it in the wrists. It looks like a flapping motion. You can also get overactive reflexes. Now, these are signs that would normally be picked up on a physical exam and may not be something that you notice on yourself. But one thing that you could notice for yourself is muscle rigidity. In mild cases, it can feel like your body is stiff, like you overdid it with a workout the day before. In severe cases, people can feel locked up and unable to move. Your autonomic nervous system is the nerves that control your body functions that are not within your control, like your heart rate, your blood pressure, and breathing, and digestion. So if you have autonomic hyperactivity, it's called, these body systems just go wacky. And these are the things that you're more likely to notice and make you feel like something is wrong. Some examples are racing heart, high blood pressure, fast breathing, sweating, fever, shivering, vomiting, and dilated pupils. You can see that your pupils are dilated if you look in the mirror, but what you experience is light sensitivity, like you may have when you wake up in the morning and someone turns on the lights. It takes you a minute for your eyes to adjust. But with this, your eyes just don't seem to adjust to the light and it's just too bright for you. We don't have good numbers for how prevalent this is, and I think it's because many people have mild cases of it and never seek treatment. You may have some anxiety, loose stool, and a tremor that you think is related to feeling really anxious. And once the symptoms go away in a day or so, you write it off as maybe you had a stomach bug because of the vomiting and the diarrhea. In my 20 years of practicing, I have never seen one case that required someone to go to the hospital. I've only had probably a handful of people tell me that they had severe gastrointestinal symptoms and felt like they were coming down with the flu after they took a medicine like a muscle relaxer, like Flexeril or something, and they were already on an antidepressant from me. In all of those cases, the symptoms resolved in a day, and I didn't hear about it until weeks or months later at their next appointment. The people who do get diagnosed with this tend to be people who have more severe symptoms. And as you can see from some of the symptoms that I mentioned, many of them are non-specific things that you can see with other problems. So being diagnosed with serotonin syndrome requires a medical workup and a physical exam. It wouldn't be considered serotonin syndrome unless you had taken medications that could increase your serotonin levels and you had symptoms in all of these three areas. It also wouldn't be considered serotonin syndrome if you had a fast heart rate and diarrhea and nothing else. The serotonin medicines themselves can cause diarrhea as a side effect. So some people like to use the term serotonin toxicity to refer to extreme one-off symptoms that you can get from taking the medication, but you don't have enough symptoms to call it serotonin syndrome. The last part of Sage's question is, how deadly is this? The deadly cases are the ones that cause extreme symptoms like heart rhythm problems or muscular rigidity that causes internal muscle tissue damage. These cases can lead to death if they're not treated. Serotonin syndrome is treated under medical supervision by stabilizing your vital signs with methods like lowering your blood pressure or cooling your body to bring your temperature down. It usually resolves in about 24 hours. So here are the takeaways from this. Number one, if you're taking antidepressant medications, be careful anytime you add another medication, even something over the counter. You always want to check the drug-drug interactions. You can use the drug interaction checker on WebMD. And this applies to some prescription pain medicines like Tramadol or Imitrex for migraines. Number two, normal use of your antidepressant shouldn't cause this problem. But if you have combined it with something, look out for odd signs like fever, wide open pupils, abnormal blood pressure, and muscle stiffness. These are not the usual symptoms or side effects that you would have from your antidepressant. If you are experiencing these things, call your doctor or go to your nearest urgent care or emergency room. To determine if you have serotonin syndrome, someone will need to examine you, monitor your vital signs, and observe you. It usually goes away within 24 hours once you stop the medications. That's it. Thanks for watching and see you next time.